Hi again, everyone. Thank you so much for joining us. We are very excited that you're here. My name is Shana Watkins. I'm the Health Advocacy Programs Manager here at the Tennessee Justice Center. And with me today will be Staff Attorney Jane Dimwobi and our Senior Director of Anti-Hunger Advocacy, Signe Anderson. Um, I just have a little bit of housekeeping before we jump in. But I also just want to take a moment to say it's been a really, really rough, challenging couple of weeks for everyone. So you're here. We're happy that you're here. We made it this far. I hope that you are practicing some restorative routines. And I don't have to tell you all to be there for each other because that's just what you all do. So we want to thank you for that, though. And take care of yourselves. We're almost to Thanksgiving, so we hopefully all get a little break. Okay. So, as you are probably aware, this briefing is recorded today. The recording and the slides will be emailed to you if you are registered, and you must be registered because you're here right now. So even for those who cannot be here at the time that we're actually conducting this webinar, they'll still get the recording. Also, we're going to let Signe go first today, and Signe is, of course, our Senior Director of Anti-Hunger Advocacy. She's going to be talking about SNAP and a couple of other things. So we're going to do a Q&A right after she speaks, and then we're going to talk about health and then do a Q&A. So if you do have questions that pop into your mind, please go ahead and put those in the Q&A. We'll take nutrition first and then health later on. We love to know who's here, so please introduce yourself, as some of you have already done. Thank you. In the chat. So please put your name, your organization, and your county. I've already introduced us, but I'll do it again for those of you who've just joined. I'm Shana Watkins, the Health Advocacy Programs Manager and your moderator for today. With me is Jane Dimwobi and Signe Anderson. Just as a reminder, the Tennessee Justice Center is a nonprofit tax-exempt organization that is nonpartisan and non-political. So the clients we serve and the partners with whom we work represent the state's diversity of political affiliation. Our political analyses relate solely to the defense of health and nutrition programs and do not imply endorsement or disapproval of any party or person. I'll now give the floor to Signe. And Signe, just let me know when you're ready to go to the next slide, but the floor is yours.
Excellent. Thanks, Shana. Hi, everybody. Thanks for joining us. I know it's been a whirlwind, and thank you all for tuning in. It continues to be a bit of a whirlwind, but we are now coming to you with the government fully reopened. And Shana, you can go to the next slide. As of November 12th, last Wednesday, the House passed a continuing resolution known as a CR that ended the government shutdown. And so we're excited to see benefits come through, but there are other problems with the shutdown ending that Jane will go into later. As of Wednesday night, the president signed the CR that ensured spending through January 30th. And by Thursday, the Thursday of last week, federal workers were back at work. Paychecks were released. Funding for SNAP was restored. Air travel, we saw some relief. And also there was a promised vote on healthcare subsidies. And Jane will go into that in her slides. Just for folks who might be curious about what does this CR mean through January 30th? Is that something that we need to be concerned about? Do we need to be worried about another shutdown? What does that mean for SNAP? I'll go into that as we continue to talk, and again, I'll show the slides that we put together for this afterwards. But we are at risk of another shutdown on January 30th, but it shouldn't affect SNAP. It won't affect WIC. Because of the CR, because of the continuing resolution, there was long-term funding, a long-term funding agreement for three measures that ensures funding through September 2026. And the long-term funding agreements were for farmers, for food aid, which includes SNAP and WIC, and also veterans. But there's a lot more that needs to be negotiated, including the health side of this, that will be debated and worked on in the next 2 months. So they have to negotiate the rest of that spending package for 2026. But there is funding in place for SNAP. And just to give folks some information on that, SNAP and the continuing resolution and what that looks like. The continuing resolution response included a 3-bill minibus with full year funding for USDA through fiscal year 2026. So SNAP, WIC, and the child nutrition programs are funded through September 30th, 2026, even if another shutdown happens in early 2026. And then the Senate's fiscal year 2026 agricultural appropriations bill also includes $8.2 billion for WIC, a funding boost to cover the expected participation and maintain the fruits and vegetable benefits. So that's all the entire package that we wanted for the WIC program that would fully support the program and also maintain the fruits and vegetable benefit. Great. I think we have the slides, and you can go to the next slide. Excellent. And I think we've wrapped this one too, so we can go to the next slide. I also wanted to touch on what was happening with SNAP benefits for Tennessee households. Last week when we talked, the state was talking about loading partial benefits. So as of last Wednesday, DHS started loading partial benefits onto EBT cards for SNAP households, and they were loading 65% of the maximum benefit. However, some people saw much less than that, and some people saw no benefits. But that is all being ironed out. The folks who got the 65% of the benefit and got partial benefits were anyone who was scheduled to receive benefits from the 1st to the 12th of the month. The state agency sends benefits out based on the last 4 digits of an individual's Social Security. And so some folks get their benefits on the 1st, 2nd, 3rd, 4th of the month. And so for anybody who had not received benefits in the first 12 days of the month, they started getting partial benefits on the 12th. By Thursday of last week, USDA sent a memo stating that states have to take immediate action to get full benefits to SNAP households. And so by Thursday, we saw the state working to push out benefits, full benefits to SNAP recipients in Tennessee. And on Monday, just this past Monday, Tennessee SNAP households started to receive full benefits. So anyone who received partial benefits should have received the remainder of their benefits on the 17th. And then from the 17th to the 20th, anybody who's scheduled to normally receive their benefits during that time frame between the 17th and the 20th should have seen their normal benefits come through. We are seeing some issues with that, and we encourage families to reach out to us or households to reach out to us if they aren't seeing their full benefit or seeing less than what they're supposed to get. And I believe we might have information on that in the slides forthcoming. The next slide is just talking about some of the issues post shutdown. We've seen some confusion amongst caseworkers. Some of our clients and people who rely on SNAP had reached out to the state with questions. Naturally, with all these changes, there's lots of confusion, even amongst the DHS caseworkers And so there's been some misinformation to families, but the DHS website is up to date with a Q&A section. Some SNAP households have reported receiving the incorrect amount. So we're monitoring that as November continues and as full benefits are supposed to be getting out, because we want to make sure that families and households get their full amount of benefits. So we'll continue to monitor that. The other issue that we see and will monitor closely for the next few months are the economic impacts to families and to the state. Again, I mentioned that another shutdown looms at the end of January. It will not affect SNAP benefits getting out, but a shutdown is disruptive, and even folks who went through it for the past couple of months. I think this quote speaks loudly to the effects of it, but stress and hunger are great tactics for traumatizing people. And we saw a lot of people traumatized during the last couple of months. Federal workers who lost their source of income for almost 2 months. And then in the last couple of weeks, where we saw people not getting benefits come through, all of that, we're expecting to see long-term impacts to low-income families who might have had to skip paying rent or bills, or had to make other sacrifices in order to feed their families during the weeks that they did not have access to the SNAP program. So we will continue to monitor that. And then I think the next slide is some of our other areas of focus. As we come out of the shutdown, we are going to continue to build efforts to educate and inform about the importance of SNAP. I think all eyes are on the SNAP program right now, so it provides an opportunity for us to make sure that people are informed about the importance of the program and how it is imperative for ending hunger across the country. We will return our focus to HR 1 in the SNAP cuts. We are doing a lot of work to inform families about the work requirement and time limits, also addressing the loss of the SNAP program to several immigrant households. And we will also be doing a lot more focus and educating around the cost shifts of the SNAP program, which will place an increased economic burden on the state. So we will plan to cover those issues in the weeks ahead on this call. Two things that I wanted to lift up also related to the shutdown. One, just mentioning the work requirement piece. Because of the shutdown, November is now one more month. There's been one more month of added grace for families that need to meet a work requirement. So the month of November will not count against families. So that was good to hear. And then the other thing that has popped up in the last several days is just communication from the Secretary of Agriculture talking about families having to reapply. That is not something that can happen without rulemaking. And so families should know that they don't need to apply if they've already applied. They should follow their regular schedule of recertification and dates where they need to submit paperwork to continue to access the program if they need to. For folks who are new to the program, they should apply. But the information coming out of USDA and the Secretary of Agriculture is not something that can move forward without rulemaking. So we will continue to monitor that as well. And I think we're to the Q&A section. So I'm happy to pause and take questions. And things may have come through in the chat that I've missed.
I'm keeping an eye on the chat, Signy, but I don't think there are any questions, but I'll double
Okay.
check. But we
All
have
right.
one question in the Q&A. Uh, Laura asks, when you say immigrant households, do you mean persons with asylum and refugee status?
Yeah, so there's been coming out of HR1, immigrant families who are lawfully here, specifically refugees and asylees, are now barred from participation in the program unless uh, they've met unless they meet certain requirements. So that's what I'm talking about are the new rules that have come out. Um, there is a much narrower population of immigrants who can access the program now because of HR1. And those are Haitian and other Micronesia. And there's a very, very limited list of immigrant families who can access the program.
Thank you, Signy.
Mm-hmm.
The next question is in the Q&A. Tiffany asks, does this mean that work requirements take effect on December 1?
So it means that yes, you should have all of your paperwork in by December 1. And I would work proactively to get information and paperwork before December 1. In fact, meeting that November 1st deadline is a good idea, just to make sure um, that you have all the information to DHS. But uh, the 3 month for now is going to be 4 months, so it now includes November, and so you don't have to prove work for the month of November.
Okay, and then another question from Christina. I think it's Christina. It's cutting off the name, so I hope I'm getting that right. So she asks, Secretary Rollins has said the department will, quote, completely deconstruct, unquote, the SNAP program in an effort to remove fraud and corruption from the program. What does this mean?
Yeah, so that's what I was referring to earlier. The I think the issue with that is there there's a misunderstanding and a lack of knowledge from the secretary of how the SNAP program works. They can't make everybody reapply without changing the rules of the program. And it would cause utter chaos for states to make everybody on the program reapply. So that's not happening unless they change the rules. But before the USDA secretary or the Secretary of Agriculture accuses people of breaking the rules, I think it's really important for her to understand the rules of SNAP and how the program works. And DHS has some Q&A where they're telling people you only need to apply if you're newly eligible to the program. If you've already applied and have been approved for the program, you should follow your regular certification period. So if you're due for recertification, then it's time to submit paperwork. But if you're not, you shouldn't. Families do not need to reapply right now.
Okay, thank you, Signy. We had another question in the Q&A from Jess, but you have already answered it. So, but maybe it deserves a little bit of underscoring. So Jess said she had a family say that they had to reapply for SNAP benefits due to the shutdown, but they had the benefits before the shutdown. So it sounds like they
Right.
were kind of the victims of this confusion.
Yeah, no, you're absolutely right, Shana. And just too, I think there has been so much confusion because of the shutdown. Um, so I think likely families who might not have understood what was happening with the shutdown and why their benefits aren't coming through may assume that they need to reapply, but that's not the case. If you've got your approval letter and you normally receive SNAP benefits, there's no need to reapply, um, and unless you're due for recertification. So I think it's important to, because of the shutdown and because of the misinformation from the Secretary of Agriculture, to reiterate that people do not have to reapply to the program if they've already applied and been approved.
Thank you again, Signe. And thank you, Jess, for bringing that question back up because we do want to make sure that people are very clear. We know that you will probably, that you, the audience of this webinar, will probably go back to your clients and your communities, and we want to make sure that we're giving you really clear information. So anytime you need clarification, please put it in the Q&A. We do not mind at all. Okay. Signe, are you going to be able to stick with us through the rest?
Yeah, I can stay on the line. So I'll be here if any other questions come up. Thanks
Okay,
everybody for
thank you.
being here, and we're always curious to know what you're hearing. So share with us in the chat or let us know offline.
Yeah, we cannot stress that enough. Stories are really, really, really important. The media is asking us for all kinds of stories about SNAP, so they really, really, really do make a big difference. Okay, let's move on to health, but we can, if anybody formulates any questions about nutrition, we can come back to it at the end. But I'm going to hand it over to my colleague Jane Dimwobi to talk about health policy.
Thanks so much, Shayna. Signe set us up quite nicely. We've been talking about this since I would say December of last year when we started these briefings that SNAP and Medicaid are intertwined, and we just saw that in the last few weeks when SNAP was used as a way to leverage votes on tax credits. So we've kind of come to a resolution on SNAP, but there's still lots of questions on the healthcare side, and I'll be focusing on kind of clearing a lot of the confusion out there and hopefully giving people information they need to take action. Next slide, please. Great. So we all know that the government shutdown has ended. About a week ago, the official bill was put forward that did end the shutdown. As we discussed this a little bit last week, but 8 Senate Democrats broke ranks in terms of the standoff on premium tax credits to negotiate with Republicans to get to kind of a bipartisan government shutdown. The bills funded most federal agencies through the end of January and some through September 30th of 2026. So we don't have that list right now, but there are for SNAP and WIC, for a bunch of the nutrition programs, there's no question that they'll be fully funded for the next fiscal year. So there won't be any question about availability of funds until around this time next year when there needs to be a future agreement on continuing resolution. As for some federal agencies, funding runs out at the end of January of 2026. And so when people talk about the risk of another shutdown in January, that's what they're talking about. But we don't know exactly what those agencies are, or we can't speak to them right now. But there is kind of a conversation about how far the current agreements go. So we'll be paying attention to that. On the topic of health and nutrition, there's no risk to the SNAP program, and WIC and the kind of the drum we've been beating the last few weeks. So we know that those programs are protected, which is how it should be. They should not be leveraged in these types of funding fights. The bill also secured back pay for many furloughed employees, which is huge because we know that families were struggling in the middle of losing, many families were struggling in the middle of losing their paychecks. That was putting pressure on food banks. And then folks lost SNAP for in the first 2 weeks of this month as well, which was putting additional pressure on food banks. So we're going to kind of see more of a stabilization in some of those community feeding resources because things are sort of going back to normal. Next slide. So that's the question becomes post shutdown, did the Republicans win? Well, a lot of the information that's coming out is talking about how Republicans got a clean continuing resolution that they were looking for, and they did not make any major concessions to the Democrats. This meaning the Democrats were not successful in guaranteeing the extension of the premium tax credits. So what they did get from the fight was the promise of a vote in December on whether to extend those premium tax credits There was no official commitment by Republicans to vote. It's the promise of a vote. The Democrats did not get a commitment that the vote would be held in the House of Representatives about the tax credits, but the assumption is that would follow if there's a vote in the Senate. President Trump made no concessions to approve an extension of the tax credits. So there is a lot that was lost here in terms of the opportunity for premium tax credits, but there's a pathway to getting that extension in December, and we'll talk about that. But next slide. We do know that these tax credits are still a live political issue, and I'm going to be emphasizing this for the remainder of the conversation. So, if you've been with us since December, or even since March, or since July after the bill was passed, you know that we have been beating the drum about the crisis of healthcare that was triggered with the One Big Beautiful Bill Act, or One Big Beautiful Bill, yeah, One Big Beautiful Bill Act that is now law. And over the last 6 months, us and other advocates have been educating the mass public about these tax credits and how they're crucial to accessing affordable health care, especially in the context of losses to Medicaid funding over the next few years. This has been a nationwide effort that we have been engaging in addition to many other groups here in Tennessee and in other states. As of November 1st, as of November 1st, individuals enrolled in the marketplace were uh, were fully clued in as to the crisis that we've been talking about for the last few months, because they essentially saw their premiums for the coming year and the sharp increase that they were now being subjected to, and having they were forced to make a decision whether they could afford it or not. That is the conversation that's happening right now, and that's the noise that now individuals who are in the marketplace have been making. So advocates have been raising the profile of tax credits as an issue, which frankly, even though, hundreds of thousands of people in Tennessee and millions around the country were using these tax credits, people didn't understand why they were so critical, because they just got used to that being available, just like folks got used to a lot of tax credits being available in the last few years. So now that it's clear what is lost by taking this away, there is even more attention. So it is still a live political issue. The fight is not over. The conversation's not over, and a lot of that is through the work that you have done, raising the profile of tax credits. So we've been seeing extensive media coverage about what you'll see referred to as healthcare subsidies. When we are talking in these calls, or at least Gordon and I are speaking on the health side, we use the term enhanced paying tax credits just to make it clear exactly how the whole structure functions. But in the media, people aren't always saying EPTC, so you'll see people say healthcare subsidies, tax subsidies, marketplace subsidies. We're all talking about the same thing. So we've been successful in garnering extensive media coverage about these healthcare subsidies, bringing people into the conversation, sharing individual stories, and essentially putting pressure on every decision maker who's in a position to do something about this. The result of that naturally has been pressure on Democrats. A lot of them centered healthcare affordability in the midterm elections that just passed, and were successful actually in getting votes on those on with those platforms. But Republicans are not out of the woods either. They have similar pressures to solve the problem of healthcare affordability, whether it's through tax credits or whatever. Their constituents are asking, "What am I supposed to do if my premiums double or triple?" And we'll talk a little bit about that. So now we have Republicans scrambling for alternatives to extending the tax credits, because, to be honest, they still don't want to do it, but they can't get away with doing nothing when it comes to supporting access to healthcare. So we're in a position where we, and I say we as a collective, everyone on this call has raised the profile of tax credits to the point where it's unavoidable. For the rest of the year, we will be seeing headlines on this issue, and the goal is to push the decision makers in Congress towards extending these tax credits and making sure that come 2026, households aren't facing these unbelievable premiums. So that is a thank you. That is an acknowledgement of the work that we've all done to raise the profile of this, because I think a lot of people could not have talked about healthcare subsidies 6 months ago. But now we're at the point where this is the only thing that keeps being brought up when it comes to healthcare affordability. Next slide, please. So that sets us up very nicely for another hectic year in 2026. So the affordability of healthcare coverage remains a key issue for Democrats. Their constituents are very passionate about this issue, and that's something that we expect will be highlighted in the midterm elections. So millions of Americans are relying on the marketplace. And almost all of them use tax credits so that their coverage is affordable. And come January 2026, they are facing significant rises in their premium costs. So we are like I said already several times, this has been a benchmark issue, and we expect that that will continue. So that's in terms of putting pressure on Democrats and pushing their focus on this issue. That is what is working. On the Republican side, the president and Republicans in Congress are worried about the political liability of them being the reason these credits expire, and they don't want to hand Democrats an economic issue that will kind of propel their platforms in 2026. So they want to do something about healthcare, or they feel the pressure to do something about healthcare for all the reasons I just explained. Next slide. And that is why you'll hear a lot of Republicans talking about health savings accounts these days. So let's start off clear things up. Health savings accounts are not enough. Because Republicans are scrambling to find these alternatives to extending the tax credits, they are championing expansion of health savings accounts. And let's talk about that. Health savings accounts are a way for people to build a fund for out-of-pocket healthcare expenses by um, depositing pre-tax dollars into those accounts. You cannot pay your healthcare premiums using HSA funds, using these health savings accounts funds. It is something that you can put towards prescriptions or some other medical costs, which are important, but they are not an equivalent for paying premiums, which if you remember, for the last few weeks, we've been showing you the amount that someone is slated to pay for their monthly premium today, and then what that same individual is facing for their monthly premium in January of 2026. The difference in those numbers, by and large, are not going to be covered. First of all, can't be paid with the health savings accounts, but the value of those increases able to are not going to be compensated by, an X dollar deposit into health savings accounts. But the reality of these HSAs is that they provide the biggest benefits to people who can afford to contribute large amounts into those accounts, and that tends to be people in higher income brackets. So what HSAs do is you have your paycheck and you can deduct a certain amount to go into those funds. But if you already need every dollar of your paycheck, which again that's a lot of the population of the folks on the marketplace. If you need every dollar, you're probably not depositing large amounts into your HSA. So it's not building the amount isn't building that much. So the structure of healthcare affordability being built around HSAs is just a very short-sighted attempt at a solution. So just for some numbers, around 4% of people that even contributed at all to their HSA made below $50,000. So not basically this negligible amount of people who even contribute to their HSAs are below 50,000 below an annual income of $50,000. That same income limit, that's most of the people on the marketplace. So basically, most of the people on the marketplace have no avenue to even using their HSA. So how are we developing solutions for that population about to face premium hikes based on the HSA? It's again something that's serving people who are higher income, not lower income, and it's not a solution that's actually for the people. So for the people who need it the most. Frankly, most people just do not have spare cash to set aside in their HSAs. And a lot of people are already in debt due to their medical and dental bills. So this is just largely a limited solution. It's not something that I think if you come across this, you can kind of learn more about HSAs and how they work. But the fact of the matter is, for the population that's on the marketplace, that needs the tax credits to afford the marketplace, HSAs are a non-starter. Next slide. which means that the solution is still very, very clear. Congress must enhance the premium tax credit. So you have an opportunity to use the pressure that has been built steadily over the course of this year to contact your senators and contact your representatives and tell them that you want the enhanced premium tax credits extended. You want the healthcare subsidies extended. However you refer to it, push them towards um, uh, voting yes if when there's a Senate vote, or otherwise supporting the extension of the tax credits. We're at a really critical point, not only because of, again, the political pressure that's built, but also the reality of enrollment. So the way the marketplace works is open enrollment starts November 1st. So everyone who's in the marketplace has until December 15th to decide if they want to stay in the marketplace. That is a really difficult decision for tons of people right now across the country, but especially here in Tennessee, where folks are seeing numbers that they never thought that they would see, and they're having to use that to make a decision about whether they're going to have healthcare in 2026. So I have a visual here for folks who want to incorporate some data into whether they're reaching out to their representatives, or whether they want to start a conversation within their own circles. If we have this source, which I've linked here, you can all receive this once the slides go out. You'll be able to see for your congressional district what the average um, increased cost that families are looking at. So you can use that when you reach out to your representative and say, in my community, we cannot afford this. In your constituents can't afford this. This is the kind of data that is compelling for that outreach. But just some examples: a 45-year-old individual single in a single household that's at 200% of the federal poverty level, which means they're making about $32,000. They're currently paying $691 a year for their premiums, and that is going to go up to 2,159. So over triple. And the same is true for a family of four, making about $130,000, and then a 60-year-old couple making about $85,000. So there are a lot of people who were getting uh, benefits from the tax credits. Again, just like there are tons of different types of tax credits and subsidies that benefit all sorts of populations. This is the one that, as we've been saying for months, this is the one that was left out of the one bit of the one big beautiful bill. And um, we are just at we have an opportunity now to make sure that it is given the same consideration and ultimately extension as some of those other tax credits that were made permanent. So I hope these numbers are helpful for folks who are in different congressional districts and want to share that when they contact their representatives. But please remember, stories are a big part of this as well. I'll leave it to Shayna to talk about that in a few slides, but this is a resource for some numbers you can just throw into your outreach, and we at TGC do give you some resources about that. That's all I have on the update on the healthcare side. It is still very murky waters. We are working through some of the risks of the tax credits not being enhanced, which we're seeing firsthand here in Tennessee. But hopefully, with your work and our continued work, we'll be pushing some of these decision makers in DC towards extending those tax credits come December 31st.
Thank you so much, Jane. We have one question in the chat from Scott. He asks, does the ACA enrollee bear the full premium without subsidies? So I think I'm understanding that, Scott, but Jane, is that enough for you to answer that?
Yes. So the way that the ACA works is everyone, since it was created, everyone up to 400% FPL, which is about $60,000 a year, everyone making under that was on the marketplace got a tax got a tax credit to be on the marketplace. What happened in 2021 was an enhancement of those tax credits, which just made them more affordable. So by and large, people in the marketplace were receiving some kind of a subsidy for their premiums, so they weren't paying the full cost out of pocket. And then now, though the cost that they're paying is way, way lower, and they are at risk of losing that. There are some people who get their healthcare through the marketplace because they work at a small business or maybe they're self-employed, and they do pay the full cost of their premium. There are others who get their healthcare through the marketplace, but their employer reimburses them up to a certain amount. So there, a lot of people in the marketplace do have to handle, they do pay for their premiums themselves. That's number one. Number two, some people do have an employer relationship that will cover a portion of their premium cost. I hope that helps.
Thank you, Jane. But Scott, let us know if that wasn't clear. We can add to that. But Anne from Tennessee Healthcare Campaign is asking, well, not really asking, but advising wisely in the Q&A. Please encourage people to enroll because they can always decline by January 15th, but do not allow the auto renewal to go into effect.
Yep, that's very true. Open enrollment is from November 1st to December 15th is the initial period. And then there's a secondary enrollment period from December 15th until January 15th. So you want to make sure that you're in the marketplace because you can always opt out later. That is a very, very good recommendation for folks who are confused by everything going on. The marketplace is still an option. So please enroll and use that uh, enroll, and then we'll work towards getting the extension of the tax credits. But don't be in a situation where the December 15th deadline passes because you're wondering what's going to happen with the tax credits, and then the January 15th deadline passes because then you won't be able to enroll in the marketplace unless you have special circumstances. So it's really critical that folks are in the marketplace and they are, because they don't have to pay the new premium rates until next year. So they're just seeing numbers and they might be scared of those numbers, but they don't immediately have to foot the bill. We're still working on getting those monthly costs down. And until then, the recommendation is to enroll.
Thank you for emphasizing that, Anne and Jane. Thank you so much. I don't think that we have any other questions in the Q&A, but we still have time. So again, if you formulate any questions, please just go ahead and put them in the Q&A, but I'll go forward for the moment, but I'll keep an eye on questions. Today, as some of you may know, is actually a Save the ACA Day of Action. So we would just encourage you to double down on contacting Congress and making sure that they understand what your point of view is, which is hopefully at this point, please extend those enhanced premium tax credits. We would also urge them to protect SNAP so that there are no other delays. And also, I think it's really, really important for you to engage with maybe not at Thanksgiving dinner, but engage with your friends and your family and your loved ones to make sure that they're informed. No one's telling anyone else how to vote, but making sure that they're fully informed about what the tax credits do, who they help, and exactly what they are. Also, as we said before, sharing stories is a really, really, I can't stress this enough. And I know we kind of sound like a broken record on this, but we're never going to stop beating this drum because stories are maybe the number one way to not just move hearts and minds, but to truly inform lawmakers and other individuals about what these policies mean to everyday Tennesseans, our neighbors, our loved ones, our family members, our friends. So on the topic of stories, we want to share one with you. This is Shayla. And Shayla Ankenbauer is not your typical mother. I'm going to read this story to you all. As the co-owner of a tattoo shop in Lafayette, Tennessee, she's also the mother of twin boys with complex medical needs. Shayla understands what it means to juggle work, parenting, and the high cost of healthcare. For her and her husband, affordable coverage through the marketplace, made possible by EPTCs, is the only thing that keeps her and her family insured. So before getting on the marketplace, we didn't have insurance, Shayla explains. When I was pregnant with my boys, I had to see several specialists, and with those specialists, the monthly payment of the insurance on Marketplace helped cover those visits. Shayla and her husband now both work full-time running their shop and rely on Marketplace coverage to cover their health insurance while they focus on the needs of their children and their business. It definitely has helped, she said. My boys are medically complex. One has cerebral palsy and the other has other medical problems. So with them being covered by TennCare, being on the Marketplace gave us something we don't have to worry about with all the other worries that we have concerning their children. Affordable coverage has been life-changing for Shayla. She's been able to stay on her medications for blood pressure and depression. Care, she says, she would have skipped without the Marketplace coverage. If I didn't have the enhanced premium tax credits, I wouldn't go to the doctor because I wouldn't have insurance, she said. But like many Tennesseans, she worries about what could happen when the enhanced premium tax credits expire at the end of this year. I probably would not have health insurance, she said. We can afford it now, and that's the only reason we have it. And I prioritize my boys over myself. The Tennessee Justice Center hears stories of hardworking families like Shayla's every day. They do everything right, but are still caught between the high costs of healthcare and the realities of raising children, managing small businesses, or caring for loved ones with medical needs. And that's all of us. The enhanced premium tax credits have given thousands of Tennesseans peace of mind and access to affordable care. But unless Congress acts to extend these savings, that progress will vanish, and families like the Unkenbauers will once again face impossible choices between health and financial security. For Shayla, the choice is clear. We're just trying to take care of our boys. These savings help make that possible. Thank you, Shayla, for sharing your story and for giving us permission to share it with others. We're very grateful. Sometimes we find that you have to finesse people a little bit, and that's not to say that you exploit them, but sometimes people don't realize the value of their stories, and this is an example of how one is incredibly valuable because it's very relatable. Shayla is just going through her life and doing the best she can as a mom, a business owner, and a wife. She may not see that as anything extraordinary, but it certainly is, especially in times like these. So if you know of someone that we might be able to urge to share their story, it could really, really be the most important thing that they do right now. So there are 3 ways to share stories. You can fill out the secure online form at this link. You could call and leave a voicemail. This is not a phone number that anyone is going to pick up and answer. It's just a voicemail box where people can call and share their experiences. They can share their name if they want to, and a way to get in contact with them if they would like to engage further. But if they just want to get it off their chest and make sure that their experience is recorded and archived, just for educational purposes and for advocacy, they could absolutely leave their story there. Also, you can email stories@tnjustice.org. And we have a team of people who work on these stories, and it's across programs. So we're looking for health stories and, of course, SNAP stories and any other stories of people on the public benefits programs that we advocate for, like WIC. So we're listening. We give as many ways as possible for people to share and feel comfortable doing so. But I will say at that email or the online form, if people want to be, or even on the voicemail, if people want to be contacted by a living, breathing TJC staff, we are more than happy to accommodate that. There's nothing we would love more than to talk voice to voice or face to face with someone sharing such an important experience. And on that, also, sometimes we tell people that that we're collecting information about someone's experience, not necessarily their story, because some people are intimidated by the word story and quite frankly don't really believe they have a story worth sharing, but they do have an experience. And to us, whether it's a story or experience, it's definitely worth sharing. So we're listening. Um, you can also communicate, or you can also contact our communications at this email address given here if you ever have any difficulties, technical difficulties accessing any of these links or these methods of contacting us. So obviously registering to vote and making sure that others are registered is very important. Following us on social media so that you can get the minute by minute plays and to stay informed. This is the correct slide. So the correct date with the next briefing on here. So we're going to skip next week. We'll be back. We plan to be back on December 3rd. Who knows what will have changed by then, but we'll be on the case. And I know that you will too. So we appreciate you gathering here so that we can all be more informed. Here are different ways to contact our staff. And I'm just going to stop sharing my screen. I have just one or two more announcements to make. Thank you, Alice. We really, really appreciate your participation and everyone who is here today or everyone who's listening to this recording. So if you are in the Nashville area or you know people who are, the Tennessee Justice Center is hosting its quarterly resource fair on December 13th. That's a Saturday. We have several partners signed up to participate, and there will be food. There'll be food boxes and there'll be ready to eat food on the premises, and we will serve that just until it runs out. We have wonderful partners who are helping us with that. And then we have many other community resources that people definitely want to be connected to. That'll all be happening at TJC on December 13th, 11 to 1. Everyone is invited. You don't have to live here in Davidson County or Nashville. Also, I'll send more information out about this, but we also have a Protect TennCare Coalition that we would love for you all to join. We meet monthly, and this is an advocacy coalition. So we're talking about actions that we can take and ways that we can support each other's advocacy and each other's impact goals and each other's clients and those that you serve. So if you're interested in that, please contact me, and I will put my email address in the chat here. So reach out to me if you're interested. If you are from a Tennessee school and you want to be involved in that coalition, there's absolutely a place for you too. You are warmly welcome. We have a kind of a separate registration for you where you can indicate the level of involvement that you are comfortable with. So we certainly don't want to do anything to jeopardize anyone's employment, and we won't. But we also don't want there to be any barriers to people in schools who work so closely with families day in and day out, and even on the weekends many times. So we want to make sure that there are no barriers to you being as informed as possible about policy that will affect your families and also resources that you can offer to your family. So it's a great coalition to be a part of, even if you just participate passively and just come for the conversation and the resources. We're happy to have you. If you have any events coming up that you want us to know about, please send them my way. Send them to that same email address. We'll be there if we can, and if we can't, we'll help you to reach the community that is around you to make sure that people know about it. We wish you a very, very happy Thanksgiving. And again, I'll return to my sentiment at the beginning, and that is to take care of each other. And I know you're doing that, but absolutely take care of yourselves too. So if you want to have that second helping of pumpkin pie or macaroni and cheese, do it. I give you permission. Take care of yourselves. Happy Thanksgiving. Thanks to everybody. We'll see you soon.